There's a new partnership aiming to help more people here in our area get some help, get some access to health care. Kelly Mofield from the Kidney Foundation of Northwest Ohio and Dr. LaSharde Scott from the Scott Center for Observation, Treatment, and Transition are here to explain. Good afternoon, ladies. Thanks for being here today.
Thank you.
So you all started working together a little less than a year ago, almost a year. And what is this new partnership? What exactly are you all doing together?
Well, we met at a Rotary new member orientation, and LaSharde has great connections in the community, and I needed her expertise and connections. She, on the other hand, was starting her nonprofit business full-time and needed office space. So we've partnered together. She's moved in next door to the Kidney Foundation, and we're working together on all kinds of fun projects.
How about that? You know, that's why you go to those networking events. You never know who you're going to bump into. But this started off. Is it a personal thing for you?
Absolutely.
Yeah, you have two sons who have sickle cell, correct?
Yes.
And so, what did you find? You know, when they were diagnosed and seeing that treatment go forward.
So just to be very transparent, there was a lack of resources here in the Toledo area, which led me to go to Michigan, where I'm originally from, to seek help that way. Once I became more educated on the diagnosis, I brought those resources back to Toledo so that other parents wouldn't feel the void that I felt.
So you said something's missing here. We got to do something about this. So, and this is, you know, sickle cell and kidney disease. It impacts a lot of people.
Absolutely.
Right. So, in working together, how are you able to connect families to those resources that they need?
So 1 out of 365 African Americans are diagnosed with sickle cell disease every year, as well as 1 out of 16,300 Hispanic Americans are diagnosed with sickle cell disease. So 30 to 50% of my patients will experience kidney complication in their life.
Okay, so that can lead to that. But then with the Kidney Foundation, you find that folks maybe need to seek care you know, for a variety of reasons, and it could be disparities that they're facing.
Absolutely. We know that of the people that get kidney disease and go all the way to stage 5 and need dialysis, if you are a person of color, you're 3 times more likely to end up on dialysis. So kidney disease is an effect, not necessarily a cause. The causes are diabetes and high blood pressure, even sickle cell affect the kidneys. We want to educate people about whether you have sickle cell or diabetes or high blood pressure or any other factor that contributes to kidney disease. We want to educate you so that you can stay off of dialysis and stay healthy.
So prevention here.
Absolutely.
Yeah, so what do you want families to know, you know, in terms of getting the care that they deserve and that they need for their families?
Well, one, be the best advocate for yourself, making sure that you potentially find people that look like you to help you navigate through these systems, right? But as far as the services that we provide at Scott, is definitely to make sure that we're bridging the gap in the community to those resources and educating the community on it.
Yeah, and helping the people you have so far helped.
Yes.
What have you found when you hear their stories and maybe their struggles or you know, how they've been helped through healthcare or maybe not helped as much in the past?
Definitely there's a lot of similarities that I experienced, that void of not knowing what's available in the area. But more importantly, I know a lot of times people are just not aware of what sickle cell is. So I'm doing due diligence to make sure that I'm in the school systems, to educate the school, making sure that I'm stepping up and going to all different types of community fairs so that they see me advocating and spreading that awareness, and then we can build rapport that way.
And then, you know, as you said, you were in a situation, you want to help other people maybe not be in that situation where they're finding that they need to travel or they need to, you know, really go out of their way to get the health care that they need for their families. So if people are interested, they're at home, they said, yes, I need help, I need support, how do they get connected with you all?
For me, you can visit scottcenteroh.org.
We're also having an open house this weekend.
Oh, wonderful.
So from 10 to 12 on this Saturday, we are having an open house at our offices.
Okay.
You can come learn about our services, what's available, meet both of us, and find out ways you can become connected.
That's a really good opportunity there. So jot down that address. You got a pen and paper, and from 10 to noon then, Saturday, you said, right? The 15th?
Yes.
It's hard to keep track of the days.
Yeah, they're flying by.
Ladies, thank you so much for being here today and for what you're doing. We appreciate it.
Thank you.